Hello and welcome to another episode of RN Cliff Notes. All right, today we're looking at fluid and electrolytes. This time we had a special request from a class that wanted insight into the processes of osmosis, diffusion, and active transport, right? Okay, so let's jump right into that. And what are we doing at RN Cliff Notes? Helping students to see through larger concepts by giving you study smart strategies. Okie dokie. Here we go. So anyway, your number in your paper from 1 to 5 or your device, okay? And we're starting out this way, and we're going to name those three processes, but I'm going to give you the order of those processes, okay? So you write down the name, and we previously gave you the word bank, so all right, hopefully you remember that. Okay, so number one. Number one, this particular process requires energy in order for it to be complete. So number one, this particular process requires energy, right? Number two, this process involves the movement of a solute or ion. So this particular process, for number two, involves the movement of a solute or ion. Okay, so we're ready for number three. And number three is the movement of water. Okay? All right, so movement of water, number three. All right, so let's backtrack. So the very first thing we said was a process that required energy. That would be active transport. You should have active transport down as number one. Number two, we said the movement of a solute, right, or an ion. That would be diffusion. Yes. All right, we're coming back to that. Then number three, when we're talking about the movement of water, we're talking about osmosis. All right. Good, good. Okay. Now, as we continue on, they won't be in that order that we just quizzed you in, right? So the very first one we're going to talk about here in a bit is osmosis. Osmosis, which is the spontaneous passage or diffusion of water. Now, we emphasize the fact that there's a semi-permeable membrane involved. And wow, that word semi-permeable membrane, right? What are we saying, semi-permeable? Here's what we're saying. First, let me give you this as a quick little example. So, an experiment that I've performed before is to take a bowl of water, put a little bit of sugar in there, right? Then take a Ziploc bag, put a little water in there, and a sugar-sensitive strip. Now, this strip typically starts out as like blue or white, and if it's dipped into sugar, it'll turn black. But we're not going to put it in a bowl, right? We're going to take that white strip and we're going to put it in the Ziploc bag with the water. Then dip the lower portion of that bag in the bowl, right? And allow that to sit overnight. So, come in the next day, and surely that little strip of paper inside the Ziploc bag, right, is black. What happened? Okay, through the night, water and some of the sugar permeated the Ziploc bag. And see, in our mind, we look at the Ziploc bag like, nothing can get in there. Well, as it turns out, that is also a semi-permeable membrane, okay? So, some of that got through. Now, that was that experiment. But let's flip that into a scenario involving our patients so you have some higher level of understanding, right? So, if we look at some of our patients, particularly those in long-term care, unfortunately, right? So unfortunate. Many times some of those folks are sitting in jerry chairs and things like that, got their legs in a dependent position, right? So that's like causing more of their blood circulation to sort of pool in their legs. But to make matters worse, sometimes those folks don't eat enough protein. And what happens? Well, there's a few things that attract water. Water can't help but follow certain things. Water loves to follow salt. We're going to get into that in a minute. Water also loves to be around protein, right? So if you're eating enough protein, your water will tend to stay in your vessels, okay? But if you aren't eating enough protein, then some of that water will leave your vessels and go out to where there is some protein, right? Particularly in your lower leg, because there's this giant bit of protein here on your lower leg, right? Let's do a little bit of anatomy here, just to bring you into the know, make sure you're good, okay? So, on the back of your lower leg, name that muscle. And you say, all right, you said calf muscle, shame on you. Right? Shame. Hey, listen, this is nursing, you know what I mean? This is medicine, things like that. We left the calf muscle behind. We left that for the lay people. We are people in the know, right? So that muscle is called the gastrocnemius behind your lower leg. Gastrocnemius, not the calf. Okay? And then when you say that word, some people, oh, gastrocnemius, why can't it just be calf, right? I'll tell you why it can't be. Because of this. Okay? So gastro. We hear that in that gastroc, right? Gastro means what? Belly, stomach. Okay? And then a little play on words, right? Nemius. Knee-mius. Right? Below the knee. So we put it together, what do we have? The belly below the knee. Like, okay, well, what does that mean? Well, you know, for some people, their belly sticks out from their body, right? And in this instance, your gastrocnemius sticks out from the body of your lower leg. It's known as the belly below the knee. Ah, okay, yeah. But that's what you came here to do, is learn, right? Okay, that's right. Okay, so anyway, you got that massive amount of protein sitting what? Right outside your vessel. And what does the fluid inside your vessels want to do? Go out there and be around that muscle. So if you go into a long-term care facility, right, you're going to visit a relative or somebody, right, and you look at some of those people's lower legs, and some people's legs are like massive, right? They look so full, you just wonder like, whoa, what is going on with that person's leg, right? Why aren't they doing something about it, right? Okay. Then when you see the nurse do a dressing change, and they unravel the Curl-X, right? And the soaking wet gauzes fall off the side of their legs, and you're like, what is going on? That's what's going on, right? The water from the plasma in the person's blood is seeping through the semi-permeable blood vessels, right? And doing what? Coming out to be with the calf muscle and all that protein out there in your leg. Well, it gets to the point where it's pulling so hard, it starts to actually seep through the next semi-permeable membrane, which is your skin, the layers of your skin, and start to actually seep down the sides of patients' legs. And that's why you see their legs massive and it's wrapped up with Curl-X gauze, right? And those dressings are like soaking wet all the time, right? Okay, we're gonna come back to that, right? So, okay, all right, so now, here's my little drawing of what's going on when it comes to osmosis, okay? So we got our salt over here, right? We're on a salt shaker. Don't ask me why it's blue. I mean, we need a different color, right? You can't have white on white. So anyway, we're gonna take the salt and we're gonna sprinkle that salt to the A side. And there's a semi-permeable membrane here in this green, okay? After we sprinkle that salt into that side, water goes from the B side to the A side where the salt is. And then we see that there's a significantly higher amount of water all of a sudden. Why? As water's following that salt. But now, as much as this looks like a picture on the board, it's important to emphasize we are actually talking about your patients, right? Okay, now in what regard? In this regard. If we look at things like the DASH diet, by the way, what does DASH stand for when we're talking about diet? For people with hypertension, right? And you should have said DASH, what? Dietary approaches for stopping hypertension. DASH, dietary approaches for stopping hypertension. Important to know. And one of the main focuses in that is what? Reducing their salt intake. That's what happens. Water follows salt, and now your patient winds up with a massive amount of fluid remaining in their vessels. And then what does that do to the blood pressure? Drive it way up to dangerously high levels. Wait a minute. I'm not done with it yet. Because we just made mention of that similar effect happening with protein. So wow, think of some of your patients that are like doing double duty. So they're eating some salty food that's actually a meat, you know, like smoked meats, beef jerky, things like that, smoked sausages. Some people eat that all the time, right? Or they're on some type of Atkins diet or something like that. And they're basically counteracting the blood pressure medication that the doctor may have ordered for them, right? So that DASH diet becomes important. But your insight in terms of helping them to control their salt intake and to balance their protein intake, as we just saw, as we just talked about, too little protein intake, what happened? Edema in the legs, especially in the lower legs, right? All right. Then the other thing we saw was that protein had an impact as well. Protein and salt together. Okay, good. Anyway, moving on. Now, we talk about diffusion. Emphasis on the diff part. Diffusion is different, right? Because we just made mention of osmosis, which was the movement of water. But diffusion is different because it's the movement of a substance. You want to catch those terms. So water is a solvent, right? The universal solvent. Whereas we're talking about a substance right now, which instead of substance, we could say solute, right? So make sure you're getting those words. Water, solvent. Substance, solute. Okay. But now, this substance is moving from high to low areas of concentration. I want to emphasize that, because that shows up on tests a lot, right? Diffusion from high to low, and it's a what? Substance. Okay. But let's make it plain. So we said high to low, right? So let's put ourselves on top of a hill, and we take a basketball on top of that hill, and we set the basketball down, and it starts to roll down the hill, what? Passively on its own. It doesn't need anybody behind it actively pushing it, right? It rolls on its own. Why? Because it's going from high to low. That can be done passively. So make sure you catch that too. Diffusion is what? A passive process. There's no need for active energy in that. Nobody needs to, right, push that ball down. By the way, osmosis is also what? A passive process. Okay? Both of them are passive processes. All right. By the way, well, let's add this other piece. In many of your homes, you have an aromatic diffuser in your home, right? So you've got the little sticks inside of the oil, and it's sitting in like a corner of the room, right? And notice that where it's located, as you walk towards it, what? You smell it more intensely. You go into where it's what? A greater concentration, right? So that scent is moving from what? Great, an area of higher concentration to an area of what? Lower concentration, where you're standing. And that's why it's called a diffuser, with diffuser sticks, helping to diffuse the aromatic oil. Yeah? All right. Okay, now, so to demonstrate that, using our salt again, so we dump quite a bit of salt in the corner of the beaker. And what happens? It diffuses. It spreads out. It moves from an area of higher concentration to areas of lower concentration, right? So, yeah, diffusion. Okay. Now, we move on to active transport. Now, the other processes we said were passive. This one's active transport. And what we want to point out to you is that with active transport, this time, we're going what? Up that hill we were talking about with the ball. We're going from lower concentration to high, right? So those molecules are moving from an area of low to high. So this time we have to roll the ball ourselves or kick the ball, right? And use energy to get it up the hill from low to high. By the way, we mentioned energy. And what is our abbreviation for energy when we're talking about processes in the body, particularly at the cellular level? What's energy? Energy is, if you said ATP, good for you. And notice, we just highlighted that, right? So we said what? With active transport, we see that it's what? ATP. So, as a note to you, to help you out in testing situations, to remember that this is the one that requires energy, ATP is actually in the words for active transport. Now, let's try it out a little deeper. So, ATP, what does it actually stand for? Okay? And you say, right? All right. Some people are like, was ATP, is that good enough? No. Adenosine triphosphate. Adenosine triphosphate. Okay. Good. All right, so now, more of my computer art. Okay. So I've drawn a biphospholipid layer here. Okay, so the cell membrane is made out of biphospholipid layers. So it has a phosphate head, right, and these tails, and the heads are always on the outer parts, right, or the innermost. Okay, so anyway, you got this little protein channel here. Now, if we have our salt, or let's say sodium, and break it down a little further, right? So if the sodium is helped through this channel by this specific transporter, that's slightly different. That's one we would call facilitated diffusion, where this little protein channel, right, or a specific non-specific channel, help to move the sodium. You don't see that one as much. You don't see that one nearly as much. Actually, many times you don't see it printed in nursing books, right? They tend to stay away from facilitated diffusion. But what's happening? This structure in the cell membrane is facilitating, right, the movement of that sodium to the other side. Okay? But now, all right, so let's go this way. Now we want this to go to the other side, and we want to demonstrate active transport. Now, active transport, we said, require what? Energy. So, we got our little sodium there that wants to get to this other side, but that gradient, there's a gradient there where it really shouldn't be able to do it, but it can with extra energy. So, in comes the energy, right? So, all right, we got our little energy bolt there. It's going to help the sodium get to the other side against the concentration gradient anyway. So here we go, right? So it zaps the channel and helps that little guy through, and he's able to get through to the other side, right? All right. Okay, now, as we move to the end of this, what I want to do is also use this potentially to demonstrate another concept before we wrap up. And that concept is filtration. So think of coffee, right? Coffee is like the perfect demonstration outside of the body when it comes to filtration. It just is. All right, so we put the water in there, we got the coffee grinds in there with the filter, right? But the essence of filtration is this. So yes, the water goes through the filter and leaves the coffee grounds behind. What happens? Smaller bits of solute are actually able to come with the water. And when that happens, you wind up with your coffee, your brown coffee. Why? Because microscopic or tiny little particles of the coffee ground went with the water. And that actually happens in your body. That same process can happen where you have filtration occurring, whether it's in the nephrons or the kidneys and things like that, right? And the liquid goes through and some other substances go through with it, right? They're able to make it through the filter. All right. Okay, so now, just a quick recap. Time for 4 and 5. And we borrowed our little Cliff Notes hill for this one, right? So, for number 4, what was the process that went from an area of higher concentration to lower? And then 5, what was the process that went from an area of lower concentration to higher concentration? Okay? And you should have put the following, right? And shame on you if you're sitting there just saying this stuff to yourself. Write it down. Hello, right? Psychomotor. Okay. Yeah. All right, so 4, diffusion. We said it's different, right? Going from high to low. And that was what? Solute moving, right? Substances, ions. Okay? And then 5, active transport. Something needed some extra burst of energy, right? ATP to go against the gradient from low to high, right? All right. Hey, thank you guys for liking, and especially thank you note takers for joining the family and subscribing, okay? All right. Tune in for the next episode, all right? Thank you.